Hey everybody, it's Dr. Preston with Orthopedic Specialist. I'm here to talk to you guys a little bit about weight loss, good eating, and how it affects our musculoskeletal systems, okay? I had the opportunity a couple weeks ago to attend a CrossFit seminar in Santa Cruz and picked up really some great material on how to better take care of patients, and also how we can even better apply and teach people about our LeanMD program in the office. For those of you currently enrolled in LeanMD, you know a lot about it. For those of you who aren't enrolled in LeanMD, you want to learn more about it, we'll talk a little bit more about that today. But what I want you to understand really is where we are and where you are as people, as we age, and where we're trying to get to. And I picked this up at the CrossFit seminar. I think it's outstanding. And really, it demonstrates the fact that we all live in a continuum in our lives from sickness, wellness, and fitness. And we all land in different spots on this continuum, really based on some basic markers on how we are metabolizing our food and how we're taking care of our bodies, okay? If you're living over here somewhere in the sickness zone, obviously it's a goal to get to wellness. Avoid getting down here into sickness. And once you're up here in the wellness zone, you want to do things that are going to help bring you over into the fitness zone, okay? Knowing that we're all going to go back and forth in these areas over time. And really, let's define these real quick. First of all, fitness. Fitness I would define as somebody who's fit, may have a blood pressure, something like 110/70. Their body fat, somewhere between 5 and 15%, depending on whether or not you're a man or a woman. Hemoglobin A1C, which is a basic marker, in my opinion, of diabetes, or how we're metabolizing our glucose, based on how much glucose we're bringing into our bodies. Having a hemoglobin A1C under 5. If you have these sort of markers, I would say there's a good chance you're fit. Wellness being a blood pressure 120/80, body fat maybe between 15 and 25%, and a hemoglobin A1C somewhere under 6. Now, as we begin to slide on these markers and develop a sickness state, blood pressure might be 160/100, body fat 20 to 40%, hemoglobin A1C over 7. These are all markers, these are all things that make a physician worried a patient's becoming sick. But also think about musculoskeletal wellness and how it fits into this, okay? If someone is in this sickness zone, there's a good chance that they're gonna have issues with decreased activities of daily living. That means they're getting maybe knee pain, just walking up and down stairs. They're having difficulty getting in and out of a chair, all right? Maybe they're beginning to trip and fall down. That could be somebody in musculoskeletal who's going from wellness to sickness, okay? If you're well musculoskeletal, I make the assumption that you can move yourself, okay? Not just can you move yourself, but you can also begin to move yourself through multiple sort of domains, i.e. multiple situations. You can't just go up and down stairs, but maybe you can do multiple flights of stairs. You can't just go up and down stairs, but maybe you can hop over a retaining wall. You can do some more advanced movement activities, moving your body, moving yourself, okay? Now, as we move over into the fitness zone, I assume somebody who's fit can begin to not only move themselves through multiple domains, but also maybe move load quickly, the ability to move load, the ability to pick something up and move it, the ability to pick something up overhead and store it, okay? So I'm gonna put move load over here and correlate somewhere with this fitness, wellness, sickness criteria and define how a patient is living, okay? And that's where things like LeanMD come into play, all right? In LeanMD, we try to teach patients how to lose weight effectively, lose body fat, but also how to eat better. So really, when I think of LeanMD, I think of three really important things. First being calorie restriction. We use calorie restriction to rapidly lose weight, okay? We do that also through whole food eating, calorie restriction with whole food eating, and lastly with accountability. Accountability by coming in and checking in with a mentor, weighing yourself, having an app, record what you eat, know what you're doing, and know how your body's reacting, okay? Also remember, in LeanMD, calorie restriction is not sustainable over time, all right? We use calorie restriction as a tool to get to an ideal weight. So we go through a weight loss phase, but then once we hit that weight loss phase, we gotta make sure that we can transition to increase calories. We do that over time, maintaining whole food eating and accountability. And ultimately, once we've mastered that, we go into a sustained phase where we still whole food eat, back off on a little bit of the accountability, but only come into the office once a month to check in with a mentor, make sure we're staying on track. So as we're sliding through these zones of sickness, wellness, and fitness, we have somebody to check in with once a month and actually see objectively where you're at, okay? So take home is I really enjoyed learning about this kind of curve. I think it taught me a lot as a provider to help other people, and hopefully it'll help you learn how to take better care of yourself and how to ultimately eat better, take care of your body. There are always great resources available. Learning more about LeanMD at LeanMD.com. I've got some information on my personal professional website, CharlesFPrestonMD.com, on the New Orthopedic website, NeuroOrtho.com, and ultimately at CrossFit.com as well. There's always a lot of great nutritional updates that I read and enjoy, and you can read and enjoy it also. Hope this has been helpful. Thanks.